sitting with Dr. Jeff Zhao today with Dallas Orthopedic and Shoulder Institute. And he's going to explain to us with a visual here what exactly is a Makoplasty.
Okay. Makoplasty is essentially not a procedure, but a technology for a procedure that's already been existing. I still do a decent amount of knee surgery. One of the procedures for knee is a partial knee replacement. Everybody knows that you have your knee's arthritic, the whole thing's arthritic, you completely replace it. It's a total knee replacement. It's a very good, very reproducible procedure with a good predicted result. Now, there are a subset of patients that are young enough, but their knees are killing them. And then when you look at x-rays and MRIs and all that kind of stuff, maybe they only have portion of their knee that are really arthritic, that's really bugging them. The rest of them are just as normal as you can be. The idea is to how can we save as much of your own material, bone, ligaments, all that kind of stuff, and not replace them, because those are not bad yet. We just replace the parts that's no good anymore. But this procedure has been existing for quite some time, except the small problem. You have to be very, very accurate, down to the literally millimeters, because partial knee is whatever you are removing the arthritic bone, you have to replace it back on to make it work. If you don't put it right exactly where it is, the failure rate is fairly high. And this has been tested out even since the 70s, 80s. That's why later on, people just, even if there are good bone stock, you remove it, because the results for total knee replacement is more predictable. So that being said, Makoplasty is a software with a robotic arm that allows that kind of accuracy for partial knee replacement. It literally calculates half of a degree by half of a degree, 0.3 millimeter by 0.3. I mean, I can't even tell you how much is 1.3 millimeter eyeballing it. So that's how accurate it is. So this is a knee model for partial knee replacement. So you can see that we saved the ligaments in the middle of the knee, and then if the inside part of the knee is arthritic, we'll only change the inside part. If the where the kneecap is sitting, the patellofemoral component is arthritic, then you change that and you save the rest of it. Because the ligament in the middle, the ACL and the PCL are protected, the return back to activity is a lot faster. I rarely see my total knee patient back not using a walker at 2 weeks out. I rarely see the partial knee replacement, the Makoplasty patient come back at 2 weeks, still use a walker or cane. They just usually just walk in to shoot an X-ray. Wow. So this is definitely a good thing that avoids a lot of complications that we used to encounter for partial knee replacements. Yeah,
it sounds like it's pretty cutting edge, and I would imagine some of the viewers watching now are realizing that they may be a candidate for Makoplasty.
Could be.
So hope so. If that's certainly a need for them. And this is Dr. Jeff Zhao once again with Dallas Orthopedic and Shoulder Institute. My name's Elisa with justorthopedic.com. To learn more, visit us on Facebook, LinkedIn, and Twitter.